My name is Briant Sikorski. I'm an independent financial planner with Stratos Wealth Partners. And I typically help people with planning, and that may be financial, insurance, college savings, estate. And one of the things that has always been important to me is making sure that I've done my part in trying to educate both the community, I guess, as a whole, and also my clients. So I do host a webinar like this every single month. And when it's done, that's what I was just finishing as I was recording or hitting the recording button. And it will be recorded and uploaded to my YouTube channel. So if you go to BriantSikorski.com and click on YouTube, it'll take you over to my YouTube channel. So if you want to go back and revisit this information again, you can do that at your convenience. Now today we're going to talk about healthcare, how to plan for our costs in retirement. And one of the factoids here that I thought was pretty interesting is right off the bat it says that 4 out of 5 people cannot accurately estimate how much they expect to pay for healthcare in retirement. Now this publication or this presentation is being provided to me by, you can see over here on the left-hand side, Nationwide. Nationwide is an insurance company, and so they have a lot of involvement in this topic. And since I am an independent financial advisor, I can sell and service nearly any insurance company, any mutual fund, any product out there whatsoever. So I'm fortunate in being able to use information like this. So a lot of concern has come up as a result of this, and that's due in part to the historical growth in healthcare expenses relative to overall inflation. And I think we've seen that, on the news time and again. A lot of the discussion a few years back about the Affordable Care Act was poised to try to address this issue, and maybe it bit off more than it could chew. But this is definitely something that is of concern to most Americans and most investors. And I think in part because along with pensions and retirement, you can see an incredible movement away from companies providing, if you want to call it cradle to grave benefits, like maybe my parents or my in-laws who worked in the auto industry their entire life and had, comprehensive health care coverage and pensions after death, and et cetera, et cetera. And now the trend is towards private insurance. We see the rise of companies like Aflac, where employees are being expected to purchase their own health care or their own dental or their own cancer or their own whatever policies. And we also see the ending of pensions and the emergence of 401k plans. So that's our challenge. And if you, like me, are in any one of these age bands, you can see that there's a series of incredibly important decisions that need to be made by someone between the age of 55 and 70 and a half. So we see right off the bat that if someone starts to approach 59 and a half for the very first time now, they can take withdrawals from any type of retirement account like an IRA or a 401k or a SEP IRA, and they can withdraw that without paying any penalty, any IRS 10% penalty. Once someone turns 62, this is at the earliest age that they can start to file and start receiving Social Security. We can see that age 65, people become eligible for Medicare. Ages 66 to 67 is when they start to accrue full Social Security benefit eligibility, depending upon when you were born. If you delay Social Security benefits until age 70, you'll experience about an 8% increase in benefits for the year that you wait. And at age 70 and a half, we can see here that we have to start taking required minimum distributions. And that means that essentially we are taking withdrawals from our retirement accounts every year, kind of according to our life expectancy, to the point where hypothetically upon death, our account balance has been depleted. So a lot of really important decisions that have to be made between, in this 10 to 15-ish timeline. And the penalties for not doing it and doing it correctly can be really very detrimental to your, that's a nice way of putting it, to your long-term financial success. Oops, sorry about that. Skip one by mistake here. Here we go. So retirees, like I said, have to make many decisions, most of them guided by law between this age of 55 and 70 and a half. And that's kind of along with a webinar I did a couple months back, or just a month ago, on Social Security. You'll see how that kind of goes hand in glove with these decisions of how do you transition from asset and product allocation to protecting your assets. And gee, oh, by the way, while you're at it, let's have you go ahead and generate enough income to survive you until you pass away at 95 or whatever. So when we're prior to being retired, the risks that we address and the risks that confront us include market loss predominantly, and that of inflation. Those are the two factors that can really be a detriment to our accumulation. However, once we're in retirement, we have this additional three concerns, including outliving assets, healthcare costs that we're going to discuss a little bit more today, and what happens if a spouse dies and you've been relying on two people's income and now it's one person. That can be a huge financial impact to a widow or widower. This is interesting. I mentioned as we just got started how I'm seeing this trend away from cradle to grave company-sponsored care in terms of pensions and medical benefits, et cetera. But we see here the percentage of private sector workers employed by companies that are offering health insurance, ongoing health insurance to their retirees. And you can see as recently as 1997, it was nearly 30%. Today it's not quite even 20. Again, I'm a auto company baby. I work myself at General Motors for almost 10 years. And I recall, geez, it's probably longer than I think, but maybe 10 years ago, where General Motors offloaded its entire retiree healthcare responsibility to the United Auto Workers and said, here you go, here's X billions of dollars, you take care of it for us. And in fact, I think at one time, I heard a quote about General Motors in the respect that it was really more of a healthcare company than it was an auto company because of all the employees whose healthcare benefits it provided. So if you ask, kind of the person on the street, what they think the annual estimate of annual health costs are going to be in retirement, pretty much 3/4 are going to tell you either they don't know at all or they're going to drastically underestimate the cost. And the fact of the matter is that the average is right around that middle mark, like $11,000 to $15,000 a year. And you can see only 3% got that right. So much more costly than most people think. And why is that? Well, first of all, we've seen over the last, I mean, even respectfully going back, and I'm being apolitical here, but going back to the Clinton administration when the Clinton administrator, Bill and the administration and Mrs. Clinton was trying to create those health care, I forgot what they were called, but like a module or something. I remember these graphs and charts of how this new program was going to work. And then when the Obama administration came out with the Affordable Care Act, and we've seen how incredibly complex this is. Even when we saw some of the changes to the tax code earlier this year, some of the incredible difference or incredible complexity of the tax code. Well, we'll reduce your percentage of taxes owed, but we'll get rid of this deduction, and you can no longer use this depreciation, and well, you can deduct your property taxes, but only up to $10,000. That's only if you live in New Jersey. Holy cow! So I remember when the debate was going on, it was like, wouldn't this be great if we could just mail in a postcard kind of thing? And it's done anything but that. Likely, just the incredible longevity of people now is just, again, when my father worked at General Motors, and even my father-in-law, the objective was to make it to, I guess, maybe 55 or 60 back then. Okay, I think you had to have like 30 years plus your age. If it equaled 85, you could retire. And so let's say you retired at, let's say even 65. I know my father unfortunately died sooner, but my father-in-law retired at 71, I want to say. And really what was expected to kind of happen was you would retire, you would collect Social Security, you would collect your pension, and maybe had a couple CDs in the bank, and you move to Florida and die in 5 years. Well, that's not the case anymore. So this is really, I think, if anything, this healthcare issue is going to make the tax code change a walk in the park, if you ask me. So we want to make sure that we understand, I'm not going to make it sound pretty how serious and how grave this really is, and how you may want to take some steps to ensure that you are not, amongst the populace that doesn't plan for this. Come on. There we go. So if we look at a breakdown of healthcare expenses for the average retired couple, we can see that nearly half of their expenses are Medicare cost-sharing provisions such as co-pays and deductibles. So we see that at 45%. It's important to note that premiums for Medicare's Part B and D, as well as out-of-pocket expenses, make up over half of the expenses themselves. It's been estimated that a couple retiring now will need between $265,000 and $349,000 to cover their out-of-pocket expenses in their retirement years. And it's also important to note that this pie chart doesn't even include other health-related expenses, such as over-the-counter medications and most dental services, and more importantly than anything, long-term care. It's not even in here. I think there's a slide coming up where many people think that long-term care payment is just this automatic that happens, and that it's covered by Medicare, and that couldn't be further from the truth. So we'll probably see that in a few minutes here. So this is our estimate based on the Saving Medicare Beneficiaries Need for Healthcare Expenses, and this was published in, well, actually only about a year ago, January of 2017. So this is by no means dated numbers. So Americans on the whole aren't really prepared for the reality of the costs in retirement. They don't understand how Medicare works. 47%, this is what I was thinking about, surveyed think that Medicare pays for long-term care while it does not. And in fact, according to Medicare Solutions, Medicare covers only 62% of expenses associated with healthcare services. And individuals are in large part responsible for covering the other 38%. Now, there is a website that has Medicare coverage, a database, and it tells you things like, Medicare does not cover an eye exam. It does not cover eyeglasses or contact lenses. It does not cover routine hearing exams or hearing aids. It doesn't cover routine dental care or most dental procedures such as cleaning, fillings, tooth extractions, or dentures. It doesn't pay for dental plans or other dental-related services. So let's talk about Medicare to get a better understanding of what we're really dealing with. So Medicare, as a recap, is a federal health insurance program administered by the Centers for Medicare and Medicaid Services, or CMS, for people 65 and older, any age and disabled, and those diagnosed with end-stage renal disease. How did that get in there, right? So if we look at what, number one, Medicare Part A does not cover, notice the high out-of-pocket cost for an extended hospital stay. So in days 1 through 60, there is a deductible of over $1,300. The next 61 to 90 is $335 a day. Days 91 to 50 are $670 a day. Day 150, all costs are borne by the individual. Now you do see the little phrase over here kind of referring to skilled nursing, but again, I think the emphasis that I really want to make here is don't expect that you will become immediately eligible to be paid free and clear in a nursing home, and have that paid for by Medicaid. That's not the way it works. What Medicare here, what they're really talking about is the kind of care that you will get for a very limited period of time with the objective of you recovering, not, continuing to deteriorate and subsequently dying. This is kind of a rehab period. So they really want you to be rejuvenated, recovered, and kind of out the door, as you can see here, within 90 days. Now, secondly, we have Medicare Part B and what it does and doesn't cover. And also note that your income and retirement, excuse me, I got to jump back here. Here we go. We see that how now our income also plays a role here. So if we look at this chart, we can see that if your income is $85,000 or less, or $170,000 or less jointly, then you pay $134 a month. If your income is higher than that, you can see it can be almost 3 times as much at $428 a month. This was based on your income in 2016 and what gets paid in 2018. So that's kind of what I was saying earlier about how, everything's getting a little more convoluted. Everything is having a deductible, a copay, no longer allowing this deduction, this depreciation. It's getting much more complicated, and the burden of cost is being thrust more on the individual. Now, Part D handles prescription drug coverage, and it's available in 2 different fashions. And that is, number one, standalone prescription drug plans, or PDPs, or through a Medicare Advantage plan, MAPDs. Essentially, the differentiator there is standalone prescription plans are a little bit like you would think of private insurance, and Medicare Advantage, you would think of it more along the lines of like an HMO. All people with Medicare can get Part D with an open enrollment period from October 15th to December 7th. And then you complete that enrollment process, and then you begin to receive your coverage or your benefit January the 1st. So this slide covers an overview of what Medicare Part D covers and what it does not cover. Some recent changes to Medicare Part D include an annual deductible of $0 to $405, which you see at the very bottom there. Co-pays of 25% or flat copay amounts based on what it is, based on the formulary. They call this a coverage gap donut hole of between $37.50 and $84.72 in total drug costs, where the beneficiary pays 100%. Coverage gap the insured pays includes 35% of the cost on brand name prescriptions and 44% of the cost on generic medications during this coverage gap. And then catastrophic coverage, which is reached after $5,000 is spent out of pocket, and approximately 5% copay after a coverage gap. So the donut hole discounts will increase each year until the gap is closed in 2020. I don't know if I'd bet my money on that. After that, retirees will be responsible for 25% of all prescription drug costs after the deductible until they reach the level of catastrophic coverage. This slide provides an overview of Medigap coverage. So we can see that this supplemental insurance pays only after the original Medicare Parts A and B have already paid. They do provide the flexibility to see any doctor who accepts Medicare. And again, there is an open enrollment period, 6 months, beginning with Part B effective date at age 65 or older. So for this discussion, let's look at a little bit of a case study here. Here we have a couple, a married couple, filing jointly with a modified adjusted gross income below $170,000. Both husband and wife are healthy and will not have any additional health care expenses besides required premiums. Medicare Part B premiums are based on you remember this, modified adjusted gross income, and this grid shows you the actual cost of premiums based on investors' annual income below $170,000 married filed jointly. And we see right here on the left-hand side, it's $134 a month. Okay. Medicare Part D premiums are on average about $400 per year. They vary by state and are subject to the plan a person selects. The plan would be selected based on the prescription drugs taken. Medigap insurance can vary by carrier. The median premium in Ohio for 2018 is $188 per person per month for an annual cost of about $2,200. This would cover Medigap Policy C, which is considered to be a benchmark plan. Medicare Policy F, holy cow, we're learning the alphabet here, huh? Is the most popular and covers all the same categories as C, with the additional coverage for Medicare Part B excess charges. Medigap policies range between $123 and $253 in the state of Ohio, as an example. So, not to get on the specific numbers themselves, but we're trying to show here the gravity of the number that, we could be looking at $700 per person per month, or almost $9,000 a year. I think that is probably not what most people on the street think are going to be expected of them in retirement or in their retirement years. Option 2, Medicare Part C with the Medicare Advantage plans are offered by private insurance companies to replace original Medicare and secondary insurance. And again, we have these two different options of managed care or non-managed care, and most of these plans include a Part D benefit. And I hate to tell you this again, we're going to play the same song here and illustrate what is covered versus what is not covered. Oh, I'm dying here. Okay, stop. Number 1, hearing, dental, and vision may be covered with a Medicare Advantage plan. Costs may increase for the use of out-of-network doctors. These are available as an alternative to Parts A and B that live within the plan's service area as determined by county, and that don't have end-stage renal disease. Employees pay Part B premium and any other applicable costs. So, Social Security tells people that it's best to apply for Medicare 3 months before age 65. You don't have to be retired to get Medicare. The retirement age for full Social Security benefits is slowly going up to age 67, but you can still get full Medicare benefits at age 65. You can't get Medicare benefits before age 65 unless you have a disability or end-stage renal disease. If you're already receiving Social Security benefits, say you filed at age 62 and took early retirement, you will be automatically enrolled in Medicare without having to apply again. So once you applied at 62, you do not have to apply again at 65. You will get a Medicare card and other information about 3 months before age 65 or before the 25th month of disability benefits. And this is just a list here, and again, this is being recorded, so you can watch it again later on my YouTube channel if you like. But these are a couple of resources to help you start to, learn a little bit more about some of this healthcare knowledge. These are some websites and phone numbers that you can go to start accumulating a bit of information for you. I would say 8 times out of 10 when somebody views this presentation, by right about now their head's starting to swim, their eyes are rolling back, because they didn't really anticipate there were all these different moving parts. Most people have heard about the Medicare Part D and shopping for prescription drug coverage. A lot of this other stuff, most folks have not. So how do we go about a plan, creating a plan? Well, number 1, first of all, we need to recognize the majority of pre-retirees have underestimated the cost of health care and retirement. And one of the ways, I know you're thinking, oh my gosh, how am I going to figure out all these different numbers? But one of the things that's kind of cool is some of these different insurance or mutual fund or annuity companies have created customized programs that I can use, which is great, free of charge. And they do things like determining how much to save for college based on different assumptions, how to maximize your Social Security depending upon your situation. And Nationwide has a questionnaire that will help you minimize the guesswork by putting together a personalized healthcare cost estimate. And I'm going to show you kind of what it covers, and then I'm going to show you the actual questionnaire and a copy of the assessment. Oh, and by the way, I did attach that to this webinar as well. So when this webinar is done, you will get an email saying the webinar is done, thanks for joining us. And oh, by the way, as an attachment, you will have some of this worksheet and this sample assessment. So you don't have to write all those numbers down. Now, this assessment is powered by calculations from one of the world's leading actuarial firms. They provides a personalized estimate of possible annual health care expenses and includes estimates for Medicare out-of-pocket and long-term care expenses, which we really didn't cover. And that's another one to add to your list of Social Security, Medicare, Medicaid, estate planning, long-term care, all these things that you gotta, particularly in this age band of 55 to 70, that you gotta make sure you've got covered. So this assessment allows us to easily and quickly provide you with a possible cost estimate. It starts with a 3-part 15-question fact finder on your health history, lifestyle, and history of medical conditions. It also allows you to choose a metro region for retirement, and which will more accurately calculate the cost of long-term care in that area. Now, completing this assessment is a critical step for your planning. This report will tell you about your health profile, your health risks, estimated life expectancy based on those risks, and hypothetical estimates for healthcare costs in retirement. These costs are broken down into Medicare, out-of-pocket, and long-term care expensive categories, so you can take even a more detailed view of what these costs will be. These might help you decide how to invest today to fund for your healthcare costs in retirement, so we can create what-if situations for you. And this way you have a little more confidence in putting your plan together. So this assessment, it looks, and again, you're going to have this attached, kind of looks a little bit like this. Here's a little bit of a sample of the questionnaire. And here's where somebody has started to fill in some of their information with their age, anticipated retirement, life expectancy, the state in which they live, and so on. And do they have any health issues? I think Jim here, the husband, has type 2 diabetes. That's the only issue they have at the moment. This is one of the things that you will receive as part of the report, which is this average estimated annual cost of healthcare in retirement. And this will show you both on kind of this graphical perspective and a numerical perspective. So here we're looking at by year, if they retire in 2039, I guess here, kind of shows how they're, if they look at, the different years of, 20, 18, 23, different amounts of costs that they will incur. So this would really help you out with your financial planning and your budget. We also have a little bit of a graphic in here showing the expected home health care, assisted living, and nursing home care expenses. So it says on the next page, again, this questionnaire, which is kind of peeking back here, will be in part of your email, your follow-up email. If you would like to answer those questions and fax or email it back to me, I'd be happy to run this report for you and provide it to you. I've also placed up here is a picture of what the questionnaire looks like. So again, you're going to have this. You just complete these questions and get it back to me. And then I've also included here, repeat, sorry. But I also added on a sample specific report too, so you can see exactly what that looks like. I also put on here, I was looking for it. I also added a little worksheet. So from this, this is kind of like back in college or high school, they say for every hour of class time, you'd have 2 hours of homework or something like that. So what we're doing here is in this 45 minutes, is try to provide you a bit of an overview of some of this information, and then have you use this as a vehicle to meet with myself, or if you have an advisor of your own, perhaps they can do this for you if they're approved by Nationwide. Get this information together. Information is power, and I think this is going to help you. I think anxiety is not having any idea what to expect, and I think that's what we're trying to eliminate here, if anything. So with that, I'll say thank you very much for joining me today. If you have any questions, feel free to reach out to me, Briant Sikorski. You can get to my website at www.briantsikorski.com. You can call me at 919-650-1527. All my information is on my website, and I have other information there, including links to a Facebook, LinkedIn, Twitter, and, as I mentioned, my YouTube channel. So with that, I'll say thank you very much. I'll end this webinar at about 40 minutes here, 41 minutes. Thank you again for your attention, and I'll look forward to hearing from you soon. Thanks very kindly.